Welcome to day 15 of our CPC exam prep series. Today, we're covering cardiovascular system, part 2, focusing on pacemaker and ICD procedures, vascular bypass, graft surgeries, and endovascular revascularization, all based on 2025 CPT Guidelines. In this session, we'll review pacemaker and defibrillator codes, vascular graft procedures, angioplasty with stent placement, and key CPT modifiers. You'll also get book navigation tips and a set of CPC-style quiz questions to reinforce your learning. Pacemaker and ICD procedures. CPT codes 33200 to 33299 cover pacemaker and ICD procedures. You must identify whether the procedure involves insertion, replacement, or removal, and whether it's a single chamber, dual chamber, or biventricular system. Also confirm whether leads are placed transvenously or subcutaneously. Common pacemaker, ICD codes. Let's review key codes. 33206 is insertion of a single chamber pacemaker. 33208 is for a dual chamber system. 33233 is for removal of a pulse generator. 33249 is used when inserting a defibrillator system with leads. Always check for bundled components in these codes. Vascular bypass and grafts. Bypass procedures reroute blood flow around blocked arteries. CPT codes 35500 to 35683 cover grafting procedures. Know the graft type, autogenous from the patient's own vein, or non-autogenous like prosthetic grafts, and the origin and destination vessels for accurate code selection. Endovascular revascularization. Codes 37220 to 37235 involve balloon angioplasty, stenting, or atherectomy to restore blood flow. The CPT code depends on the vessel, treatment type, and whether it's the initial or additional vessel. For example, 37221 reports stenting of the initial iliac artery, which also includes angioplasty. Arterial versus venous procedures. Differentiate between arterial and venous interventions. Arterial examples include carotid stents and femoral angioplasty, while venous procedures include central line placement or varicose vein ablation. Look for approach type, like open versus endovascular, and laterality. Important modifiers. Use CPT modifiers to report procedural details. Modifier 26 for professional component. Modifier 51 for multiple procedures. Modifier 59 for a distinct procedural service. 76 and 77 for repeat procedures. Modifier 59 is especially important in endovascular coding when multiple vessels are treated. CPT book navigation tips. Navigate the CPT book easily by marking these code ranges. 33200-33299 for pacemakers and ICDs. 35500-35683 for bypass grafts. 37220-37235 for angioplasty and stents. Use the CPT index with terms like pacemaker, stent, or bypass to locate your codes fast in the exam. Welcome to day 16 of our CPC exam prep series, presented by KS Medical Coding Academy. Today we begin the anesthesia section, which covers CPT codes from 00100 to 01999. Let's learn how to code anesthesia services based on surgical site, patient condition, and other key factors. What is anesthesia coding? Anesthesia codes are used to report services provided by an anesthesiologist or certified nurse anesthetist before, during, and after a surgical procedure. Unlike surgical codes, anesthesia codes are assigned based on the anatomic location of the surgery and other contributing factors like time, modifiers, and qualifying circumstances. Anesthesia section format. The CPT anesthesia section ranges from 00100 to 01999, and it is organized by anatomic region. For example, 00100 covers anesthesia for procedures on the head, 00300 covers procedures on the neck, and 00400 to 00580 covers procedures on the thorax. Remember, you code anesthesia based on the site of the surgery, not the anesthesia type. Types of anesthesia. There are 4 major types of anesthesia. General anesthesia, which causes complete unconsciousness. Regional anesthesia, such as spinal or epidural blocks. Monitored anesthesia care, or MAC, which involves sedation and monitoring. And local anesthesia, like a numbing injection, which is not separately reported in most CPT cases. Physical status modifiers, P1, P6, modifiers P1 through P6 are used to describe the patient's physical condition during anesthesia. P1 means a healthy patient. P2 means mild systemic disease. P3 means severe systemic disease. P4 and P5 indicate serious or life-threatening conditions. P6 is used for a declared brain-dead organ donor. These modifiers help determine the risk level and can affect reimbursement. Qualifying circumstances codes. Some situations require additional codes called qualifying circumstances. These include 99,100 for extreme age, such as infants or elderly over 70, 99,116 for total body hypothermia, 99,135 for controlled hypotension, 99,140 for emergency procedures. These codes are added in addition to the anesthesia code to reflect increased complexity. Anesthesia time reporting. Anesthesia time starts when the provider begins care in preparation for anesthesia and ends when they hand off care post-surgery. This total time is recorded in minutes. Billing typically includes both base units and time units, and accurate documentation is essential. CPT book navigation tips. To find anesthesia codes in your CPT book, go to the anesthesia section, which starts with code 00100. The section is divided by anatomic region. You can also use the CPT index, searching under anesthesia, and then the specific body part, such as hand or pelvis. Mark the pages for quicker access during the CPC exam. Practice quiz introduction. Let's reinforce today's concepts with a quick 5-question quiz based on CPC-style anesthesia questions. Pause and try each one before moving on to the answer slide.